We are a support system. We're here to help you help yourself. You're responsible for what goes inside your mouth. We're just here to support you and give you a means, because when you have a banding, it reduces, what we call a restrictive operation. It reduces your capacity to eat a lot of food.
Well, that'd be good for me, because I think if I could eat less, it would really help.
Well, in Africa, they only eat one small bowl of rice a day, and you've got a lot of excess that you want to get rid of.
Absolutely.
Now, let's go back a little bit. When we first used to staple, this is a diagram of the stapling, we used to staple across the stomach and put a few stitches in there, making a little pouch. You eat a little bit, you'd feel full. That's the principle of it. Chocolate, cheese, ice cream, alcohol, all go straight through. And the same with banding. If you have all these liquid calories, and particularly cheese melts at body temperature. Most people think cheese is solid, but if you put it in the sun at 37 degrees, it'll become liquid. These things just go straight through and you don't lose weight. So instead of stapling in the old days, we then decided to put some bands on. And I put 200 fixed bands on. The only problem with those is that when you lost the weight, the fat around your stomach became less and the band became loose, and we had to operate to put a new tightness to it.
So is this band adjustable? Can you adjust the band?
That's why we needed a band that we could adjust without another operation. And you can see up there, there's a band there. And I'm going to show you one here with this simulated model of the stomach. You can see the band. The band has got a balloon in it, which you can blow up like that. I'll make it a little bit more so you can certainly see it easily. It tightens it and loosens it according to that.
So that goes around my stomach?
It does, but we don't have a syringe in your tummy.
Yep.
It's a closed system. The band goes around your stomach here, and this port goes underneath the fat on the muscle, and we access it by just putting a needle through the skin into the port, and we don't put air in it, we put salt water.
I don't like needles too much. Is that going to hurt very much?
It's about the same as a mosquito bite. And we do it here in the office.
Oh, okay.
It takes about 30 seconds.
Okay.
The nice part about this band is we can put it on through keyhole surgery.
So how long would I be in hospital if I do go ahead and do this?
Well, we'll talk about that in just a second, but the principle is that we can put it in through keyhole surgery and put it around the stomach. So you eat a little bit, you feel full. Eat too much, we tighten the band. Now,
I see, and that will restrict how much I can eat.
And that restricts that you can eat a little bit there, feels full, it digests slowly and goes through the normal pathway.
Oh, okay.
Now, the important thing is that you don't drink at the same time, because you can just wash it all through. We usually like you to have your drinks before your meals, or about 40 minutes afterwards. Now, what's the worst thing that can happen? Well, every operation we do, you can have clots in your legs and clots in your lungs, infections in your lungs. Specific complications that occur in relation to banding. Well, the worst thing that can happen, if I perforate the stomach when I'm operating and it leaks, you can get infection, you can get very sick and get a thing called septicemia, and you can die.
Is that a common occurrence?
Well, there have been 5 deaths in Victoria in the last 4 years. Fortunately, we've never had a perforation, we've never had a death related to banding. Now, the other things that can happen. Well, the band sits there and can slip up and down. We put stitches in to hold it in position. Even then, if you vomit a lot, you can tear the stitches.